Very nice to see you all, and it's such an honor to be here. And thank you so much for the Leadership Council. And as Bob said, attention is love, and so thank you for sticking around to pay attention. So I'm feeling a lot of love right now, so appreciate it. So I'm here to talk about our work, which is around opioid addiction and treatments. We're really trying to bring sort of tomorrow's therapy to today. So my name is Joji Suzuki. I'm the director of the Division of Addiction Psychiatry. So let's jump right in. So here's where we are with the opioid crisis here in Massachusetts. This is a graph showing the opioid overdoses here. And as you can plainly see, there's been a rapid increase in the last decade and a half, really fueled by fentanyl. And so that's the bad news, that we've seen a dramatic increase. The good news is that the last couple of years, we've seen actual slight decline. This is true locally, but also nationally. But unfortunately, these numbers remain just unacceptably high, and still have a lot of work to do. And pointing out here, this portion of the graph is 2002, which is actually when I graduated medical school. And there are a couple of things about that time point. Number one is that actually that's when I sort of start to think that maybe I want to specialize in addiction treatment. I really enjoyed it. And I told my parents I'm thinking about that. And their response was, "Oh, that's great. You want to help homeless people." And I said, well, that's true that some of these, individuals in recovery are homeless, but actually the majority are not. They're fully employed. They come from all kinds of backgrounds, rich and poor and old and young and men and women. And it just kind of highlighted that sort of the perception doesn't necessarily match the reality. And the reality is this is a hidden illness. This affects most families that I'm familiar with, directly or indirectly. And so the shame and the sort of the embarrassment really keeps us hidden, which doesn't help the situation at all. So some of the, a big part of our work is to really change that stigma and the shame around this illness. But the other thing that really that time point highlights, I'm still paying off student loans, so that's another reminder. But it's that I've in a way been able to witness the entire arc of the opioid crisis and the treatment arc. This is a year that a very important medication became available called buprenorphine. And the reason why that's important is that it's one of the most effective therapies that we have in reducing overdose mortality in this population by 70%. There's really nothing else that even comes close. Now, of course, in addiction treatment, therapy, groups, 12-step, they're all very important. But both for tobacco and opioids, we're very lucky that we have medication options available. So that's the good news. The unfortunate reality is that despite it being highly effective, most patients drop out of treatment pretty early on. By 6 months, half are gone. And by 1 year, 3/4 have left treatment. And for medications, it only works if you continue taking it. And so in the 20 plus years I've been practicing, buprenorphine has been around. But once they start to fall off treatment, it's not clear what else we're supposed to do. We actually don't have any other evidence-based therapies to offer our patients. And that's been the biggest driver for me to pursue more research. And so Dr. Nora Volkow, who's the director of the National Institute of Drug Abuse, a couple of years ago sort of outlined the research priorities in our field. And one of them is that we need to repurpose existing FDA-approved medications like GLP-1 medications or Ozempic and Mounjaro. I'm sure you've heard of those medications because we can bring that to our patients more rapidly. They're already FDA-approved, safety is assured. And then the other category is really research on psychedelics. 10 years ago, it would have been unthinkable for Dr. Volkow to recommend this, but things have changed dramatically. And this researching them would allow us to bring new and novel therapies to our patients. And so that's exactly what our lab does, with the support of our department. Dr. Faba has been a particular supporter, and I'm very grateful for that. And our lab has focused on 4 key areas. Number one is that we want to provide treatment to patients in our acute care settings, hospitals, emergency rooms. Another is, I mentioned buprenorphine, that I'm still a huge fan, and we still have to do a lot more research on that. But really, we're targeting our efforts on GLP-1 medications like Ozempic and Mounjaro to see if they're actually safe and effective for our patients. And then finally, for psychedelics. It's an emerging area, and we wanted to get into this research, and I'll say a little bit more in a second. And so thinking about, tomorrow's therapy today, some of this is a combination of sort of looking ahead, but also envisioning what it's like to be able to offer this today. So David is a 47-year-old man who's been using opioids heavily for many years. His drug use has caused problems in his health, relationships, and work. On top of that, David has struggled with his weight for a long time, and despite trying different approaches, he still has trouble losing weight. His doctor recommends a GLP-1 medication, such as Ozempic, that addresses both the opioid cravings and his weight, hoping to help him take control of both. So what's interesting about the GLP-1 medications is that it's used a lot. So this is a study from the Kaiser Foundation surveying patients just whoever patient. 12% have had tried this medication already. So 1 in 8 adults have already tried these medications. In a way, reassuring the sort of the safety around it. 40% of those with diabetes have already tried it. 26% of those with heart disease, and 22% of those with the obesity or overweight. And so this is, utilized heavily. And so again, we know that the safety is really assured. So what is this, thing doing? It's actually a hormone that's released by the intestines in response to food intake. So when you consume food, it releases GLP-1, and it has wide-ranging effects on the body, the pancreas in terms of insulin, the stomach, and the liver. But really intrigues me and many people is this, what it's doing in the brain. So the GLP-1 hormone, when it reaches the brain, and there are many receptors for this hormone in your brain, for whatever reason, it really increases satiety, increases your sense of fullness, the sense that you don't need to eat anymore. And it does indeed dramatically reduce food intake. It does this in a really profound way. And so this is, these are examples are well known. Oprah is very public about it, her experience with it. And this is what she said. One of the things that I realized the very first time I took a GLP-1 was that all these years I thought that thin people just had more willpower. They ate better foods, they were able to stick to it longer, they never had a potato chip. And then I realized the very first time she took a GLP-1 that, oh, they're not even thinking about it. They're only eating when they're hungry, and they're stopping when they're full. Sort of makes sense. It quiets the food noise. This is actually a very common sort of, anecdotal report that people say. This constant chatter in the brain that they used to have about, oh, I want to eat, I want to eat, I want to eat that, I want to eat that, disappears. It's a pretty consistent, report that people have. And this is precisely why individuals are able to simply eat when they're hungry and stop when they're full, in a way which our bodies were supposed to be potentially. And so then what became interesting is that this is now being reported for alcohol. And here's some additional vignettes. I remember going to dinner for the first time while taking Ozempic. I ordered a beer, took a sip, and couldn't finish it. You know how sometimes you taste a beer and it's like, oh my God, this tastes so good, I want to guzzle it. Well, I didn't feel like guzzling. I just really felt like sipping it. Well, another one. Before Ozempic, I could consume a whole bottle of wine in an evening without trying really hard, along with a bag of chocolates. But with Ozempic, even one beer didn't feel good to me somehow. I had no idea this would happen. Nobody told me anything about the drug affecting alcohol do. This is yet another interesting phenomenon that we're seeing. Because when I mentioned to people I'm studying GLP-1s, this is, a lot of people just randomly tell about their experiences with it. Even individuals who were not even trying to stop drinking or cutting back experience this phenomenon, that there's suddenly their desire for alcohol goes down dramatically. And so the big question, the research question here, does this really apply to other substances? And so that's exactly what we're trying to do, is conduct the early phase research safety trials to understand, do these medications help people with the opioid use disorder? There's some epidemiologic data that to support it. And there's actually data for tobacco and other substances. So all kinds of substance use disorders are now currently being planned to be tested with this. But we're going to be conducting a 12-week double-blind placebo randomized trial to assess the safety and the potential efficacy of this Ozempic for treating opioid use disorder. And if it's successful, the results will support a larger phase 2, phase 3 clinical trials. So again, if looking ahead and thinking about how this might work, somebody like David takes something like GLP-1, like Ozempic, and experiences both weight loss and reduction in opioid cravings. He experiences positive changes. In the first year, he loses 25% of his body weight, which is actually a pretty common outcome for these medications, and ceases his opioid use. He feels much more in control of his life, and his overall health dramatically improves. So let's transition to another class that Dr. Volkov had recommended. So psychedelics. So here's Maria, 36-year-old, who's been fighting prescription opioid addiction for over a decade. She's tried medications and support groups, but her cravings for opioids remain strong, especially when she's stressed. Despite her efforts, opioids continue to affect her health, work, and relationships. Her doctor suggests a new treatment involving psychedelic therapy as a way to help break the cycle, and refers to a clinical trial being conducted. So, of course, this is still an emerging area. So clinical trials is the only opportunity for individuals to take this legally. This is just an article from Wall Street Journal, although it's hard to go a week without hearing something new about psychedelics. And of course, the cultural discussion about it changed dramatically with the publication of Michael Pollan's book. It's also a Netflix series, although I haven't seen it. But this idea that psychedelic drugs like LSD or magic mushrooms, the active ingredient being psilocybin, or MDMA, might help with depression, anxiety, trauma, and addiction. And so there's a tremendous amount of work being done in this area. And so why would taking something like LSD or mushrooms, help people? And that's a big debate that we don't really know for sure. What you see on the top right is a, picture of a dried mushrooms. Although in research studies, they actually don't give the mushrooms. It's a synthetic version of the active compound. But what you see, the active compound is called psilocin on the bottom right, which looks just like serotonin, which is on to the next of it. So that's what it's doing. It's a chemical that mimics serotonin, which is a very important neurotransmitter. Well, what does that do? What you see on the left, those little circles under placebo, this is under normal waking hours, what your brain might look like. The circle around it represents different parts of the brain. And the lines connecting them really indicate the connections and the sort of the signals and the communications between them and the strength. Under the influence of psilocybin, what appears to happen is that these connections become stronger. And not only that, there are many more. So I think you can tell from the picture that many more lines. And so what that might mean, and these are speculative, but that there are new connections being formed, or that these underlying connections that were weakened are somehow re-emerging. So there are many different ideas on why that might be helpful. And so there's something happening biologically in terms of this idea that new connections can be made. And this is broadly, we think about increasing neuroplasticity, the ability for the brain to make new connections. Now, and it's not just a biology. And when it comes to psychedelics, there's a lot of discussion about, does the experience itself make a difference? And there's a lot of debate and compelling evidence to suggest that it actually might. And here's a sort of qualitative study asking people what the experience was like under a particular psychedelic called ibogaine. But really similar themes really emerge with all of them. And so one of them is this idea of reviewing one's life. I saw my whole life as if it were on an old film, flickering past in black and white imagery, things I hadn't remembered or wanted. There was a lot of time spent looking at my childhood and my parents and sisters. And then sort of taking this review of one's life and putting it into the context of their history of substance use. I was overwhelmed with the remorse and the waste and loss, feeling empathy with my family over all their hopes for me dashed by my relentless pursuit of drugs. And of course, because it's a psychedelic, there's a lot of audio-visual phenomena that emerges as well as different illusions or sounds and perceptual disturbances. But it's really, again, these psychological processes are much more pronounced. And really transitioning, using that as a sort of a vehicle for healing. I was able to begin to see how, because I felt so unlovable, I paid in one way or another for love. I was able to stop that and open myself to real love for maybe the first time in my adult life. And ibogaine fundamentally changed something within me. I had done detoxes before, but always gone back. After ibogaine, I had absolutely no desire to use drugs. And these are really compelling reports. And it's not just sort of occasionally. Many of the individuals who go through the experiences report very similar sort of experiences. Now, of course, the question is this really durable? Does it really lead to sustained change? And one of the ways in which we try to maximize that, and all the clinical trials using the psychedelics will follow the same method, is the idea of this preparation and integration. So it's not just, here's your psilocybin and see you next week, kind of a prescription, but it's really done in an intentional way, combining psychotherapy with the medication treatment. So it's a really interesting, sort of a novel way to think about pharmacotherapy in psychiatry. And so the idea is that there's a bunch of preparatory psychotherapy that occurs with the therapist to develop rapport, go over safety protocols, and really setting expectations and goals and intentions. And then undergoing the drug treatment. And this is with the therapist in the room. So you're not just kind of leaving them alone and hoping for the best, but the therapist actually accompany them in the room. And it could be a single session or multiple spread out over different times. And typically it's not therapy during the drug session. It's actually the patient will wear the eye mask and the earphones and listen to music. So it's a very internal journey that they go through. And then afterwards, multiple psychotherapy sessions to do integration work to understand, what was that like and how to begin incorporating those insights they gained into their day-to-day lives. So this is what, how it's supposed to be done to really minimize the potential risks, because there are risks, but really maximizing the benefits. Now, one of the interesting things about psychedelics today is that what you see on the left is the number of clinical trials that have been conducted here around the world, actually. And so it's been a steady increase over time. So that's, that's understandable. But what you see on the right is a graph that indicates the different indications. So the orange line shows major depressive disorder. Then the red line is treatment-resistant depression. And there are other lines for bipolar and PTSD and anxiety. And for alcohol, there's literally 2 studies published ever, well, at least in the modern era. The second one just came out 2 months ago. For opioids, 0. So despite all the hype around the potential for psychedelics in treating substance use disorders, and because of the work I do, I hear a lot about it, there's been 2 for alcohol and 0 for opioids. Yet there are many, many others for depression, and of course that's important, but it's a missed opportunity in my mind. So that's exactly what we're doing. Is we're currently just about to launch our own clinical trial of utilizing psilocybin-assisted psychotherapy as a treatment for opioid disorder. And it'll be an open-label pilot as a safety trial. And again, if successful, this will lay the groundwork for additional phase 2 and phase 3 trials. And I mentioned Ibogaine, but that's a whole other sort of can of worms on its own. But we are hoping to be the first research group that would actually obtain the approval from the FDA and NIH to conduct both a phase 1 and phase 2 trial of Ibogaine for the treatment of opioid use disorder, and really assembled a really phenomenal team to be able to conduct that. And so again, if this were possible, and Maria could have been, received this treatment, she tries a new treatment that combines psychedelic experience with therapy. After the treatment, she feels a profound shift in mindset and a big reduction in opioid cravings. She gains a sense of emotional clarity and starts feeling more confident in her ability to manage stress without turning to opioids. Several years later, she has remained sober and her health has greatly improved. This treatment paired with therapy has given Maria the tools she needed to stay opioid-free and improve her life. And of course, none of this is possible without the entire team that I have that's supporting this work. And they actually do the work, actually. So I'm grateful for them. And of course, this is done also in the context of an entire clinical apparatus that I have and the collaborators that I have beyond my department and institution. And of course, we have our donors and funders who actually make everything possible. So very grateful for all of them.